All right, good afternoon, everybody. My name is Bruno. I'm the Associate Dean of Graduate Studies and Research in the Faculty of Kinesiology and Health Studies, and I'll be moderating today's research seminar, so thank you for coming. This is the second in our series for the winter term, and today we're going to be having Dr. Bruno give a presentation. Just to let you know how it's going to work, so he'll present for up to about 45 minutes, and then we'll have some time for questions. So if you've got questions, we'll save it till that time. And just as a reminder for anybody else, that the last of our research seminar will be on March 15th, same place, but it'll start at 3 o'clock instead of 2:30, so just as a reminder about that. So I'm going to turn it over to Dr. Bruno for his presentation.
Great, thank you, Bruno. So my presentation today is going to focus on a research project that I'm currently doing that I'm currently involved with a collaborator at the University of Manitoba. We've been collecting data for this project for almost a year now. So just to let you know, I won't be talking about any results of this project because we don't have any yet. So we're still collecting data, and we will be for another year and a bit. So at some point, if you're still around, I might be asked to come back and actually talk about the results. So what I'm going to talk a bit about today is the background of this project, and a bit about the methods as well, so the methods that we're using. So just as a bit of an outline, I'm going to talk a bit about back injury claims in Saskatchewan, give you some statistics on kind of the recent history of back injury claims at the WCB. Talk about the project objectives, and then the design and methods will kind of form most of the project, most of this presentation. And then at the end, I'll kind of talk about where we're planning to go, what is the ultimate aim and goal of this line of inquiry. So back injury claims in Saskatchewan. So this is kind of a snapshot of the last 5 years. The number of claims is in the second column there. And as you can see, there was a bit of a dip in 2020, and that has been maintained for the last 2 years now. It's probably linked to the COVID pandemic, with people not working, not being exposed to the same kind of risk factors at work and things. So I would think explains part of that dip. And we're now just starting to come out of the pandemic, so whether these numbers will go back up or not, I don't know. But that's kind of the recent history of the number of claims. If you look at the days, the total number of compensation days for back injury related claims, and interestingly, the compensation days per claim, there was a dip in 2021 and 2022. Now, if the pandemic had an impact on the number of claims, that would be understandable to some extent. I really can't understand why it would have an impact on the number of days per claim. So I would just and so I would expect that would be relatively constant, but it does show over the last couple of years that the number of days per claim has been going down, or at least there was a dip in 2021, and that seems to be even lower last year. And then if you look at the compensation cost per claim, the total amount that was spent for these compensations, and then the cost per claim, again, there was the same dip. So the number of days and the cost per claim seems to be going down in the last couple of years. Whether that's related to the pandemic in some indirect way, I don't know. But I mean, if you look at the numbers, there may also be a trend that things are kind of improving over time, as it were. I mean, it was relatively constant for a very long time, and then just the last couple of years. So again, whether this is an effect of the pandemic or not, I don't know. But that's the kind of statistics over the last 5 years. Now, back injury related claims are still the second leading cause of all injury sort of claims to the WCB, if you look at the number of claims per body region. So, and this is fairly constant as far back as I've looked. I've looked back as far as 2012, and every year back injuries are number 2. Hand injuries are actually number 1. Every year there's more hand injuries in this province than any other region of the body, but back is always a very close second. And then I'm actually kind of number 3, but it's a very distant third. So hand and back injuries account for a lot of the claims in our province. And as with pretty much all of the claims, it's the ones that progress to long-term work disability. So the ones where people are off work and on compensation for 3, 4, 5, 6 months, a year or more, those are the claims that end up costing the WCB and ultimately then taxpayers more money. And obviously it would have a negative impact on those people's lives as well. They're not able to work, probably being limited in terms of what they can do at home. So it's going to have a negative impact on their life. So really, the purpose of my project is not so much to limit the number of claims. There's various things that can be done in terms of trying to improve workplace safety. That's not really the purpose of this project. What I'm really focused on is this last bullet point, is can we reduce the number of claims that progress to long-term work disability? Can we somehow, when people do have a back injury related claim, can we shorten the duration of those claims? Can we reduce the number of people that then progress to having long-term work disability related to those claims? That's ultimately the purpose of this program. So the purposes are to look at risk factors that are present at claim initiation. And so, these are things, so we'll kind of go through some of them in a bit, but things that you can record about somebody, or you can collect that data on people when they initiate a claim. So they've had a back injury related claim and they submit that, and information that you can collect on them at that time. Can you then predict whether they're going to have a long-term claim, so a long duration claim, and or go on long-term disability? As I'll mention later, kind of long-term disability, there's different definitions out in the literature. We're using either 6 months or else 1 year. So a 6-month sort of duration claim, or a 1-year duration claim. Can we predict whether they're going to have a long duration claim and or go on long-term disability based on factors that you would collect at baseline? That's what we're kind of interested in doing. Now, if you look at the literature on potential risk factors and back injury related claims, people who have longer duration claims and go on long-term disability, there's fairly strong evidence for the 5 bullet points you can see at the top, and then some evidence for the next one. So I'll kind of go through each one here. So people who have high back pain intensity at the initiation of their claim, they are predicted, or they generally have longer claims, and would be then predicted to have a higher risk of going on long-term disability. Kind of makes sense. People with worse back pain, or that they're reporting higher intensity claim or higher intensity back pain, they would be expected to have longer duration claims. High back pain related disability. So this is disability specific to their back injury. So this is not about any other disability features that they may have had prior to it, but there's different methods, we'll talk about one of them, that can be used to measure somebody's back pain related disability. But people with higher back pain related disability would be expected to have longer duration claims. Presence of radiating leg pain. So in clinical practice, so medical doctors, chiropractors, physiotherapists, when we're assessing people with back pain, one of the things we always ask about is looking for, is there any leg pain? And then there's certain clinical tests that you can do to essentially look for neurological sort of involvement. And so there's different structures that can cause back pain. One of them is the intervertebral discs. And when someone has a discal injury, there's the potential that some of the discal material can be squeezed out into the spinal canal and can put pressure on either the spinal cord or on the spinal nerve roots there. And that can then cause this characteristic radiating leg pain. So with the one about radiating leg pain, that's kind of a hallmark feature of people with a disc herniation, and those tend to take longer to heal, so it kind of makes sense that they would then be expected to potentially have longer duration claims. Poor recovery expectations, so this is a subjective thing that you would ask the claimant, about their, how well they think they're going to recover, how long do you think it's going to take you to recover. So people with poorer recovery expectations would be predicted to have longer duration claims, and jobs involving heavy work. So again, that would be predicted to have longer duration claims as well. There's some degree of evidence for age, so with increasing age, people who are older also are predicted to have longer duration claims. People of the male sex compared to female sex, they would be predicted as well. History of similar back pain, so had previous episodes of similar back pain in the past, you're again more likely to have a longer duration claim. First provider, so who the person sees after their back injury, so they can see a variety of different healthcare providers, first contact, and so medical doctors, physiotherapists, chiropractors, massage therapists. And there's some degree of evidence that people who see a medical doctor first have longer duration claims than those who see a non-medical doctor, so chiropractor, physio, massage. And the last one is whether the employer has provided some kind of accommodation or early return to work program for the person. So if that's not present, or if the employer either can't or won't provide that, those claims are also predicted to be longer. So what we wanted to do was look at, because this is what the literature shows in general, to some extent, what we wanted to do was look at these as all potential predictors here in Saskatchewan. And there was a couple of other questionnaires that I wanted to include in it because, or in our list of potential risk factors. And there's not a lot of evidence at all, in fact almost none, on these two questionnaires being used in a workplace setting. They are used clinically, at least the first one is used clinically a lot, but there's no real evidence in terms of it being used as a screening tool for sort of predicting long-term disability in people with back injuries. So the first one is the Start Back screening tool. So this was a questionnaire that was developed in the 2000s at a university in the UK. It's used clinically by, well, probably by junior medical doctors too, but as a chiropractor, I know I used to use this all the time in practice. It's a very quick and short questionnaire. There's 9 questions. It takes the person probably 2 minutes to answer all these questions. And essentially, based on the answers that they give, if you look at the right box there, you can essentially triage somebody into being at a low risk for having chronic back pain, medium risk, or else high risk. And then based on that, people at a higher risk, maybe there's different kinds of treatments you want to do with them. People at a low risk, again, it's going to kind of determine or kind of help to guide the clinicians in terms of the best treatment approach. So this essentially does what we're kind of hoping to do, although this is more of a sort of a general practice setting that clinicians can use this. And if you can read some of the questions, some of them have to do with pain intensity and disability and that kind of thing. So they're asking the same kind of things. They're looking at risk factors when somebody first develops back pain, and then kind of triages them into having either a low, moderate, or high risk of developing chronic back pain as a result of that. And so, as I said, there is quite a bit of evidence in a sort of a general clinical setting to this being quite useful, but in an occupational setting, in terms of assessing someone's risk for developing long-term disability, there's not much out there yet. So we wanted to add this in. As well, the WHO just recently put out a model disability survey. Now, they produced 2 versions of this. The first version, or the sort of longer version, I think it has something like 400 questions to it, and so it takes a long time to complete. They also then made a shortened version of it, which has 40 questions in it. And so we were going to include this in there as well, because the back pain disability questionnaires that are out there, they focus a lot on people's functioning and how the back pain affects their functioning. But this disability survey was produced by the WHO, which is a more holistic look at disability. And so looking at different environmental factors and different societal factors and different personal factors that the traditional back pain disability questionnaires don't really ask about. So this was another one that we wanted to look at to see if the scores that people provide on this one can also be useful in terms of predicting who could potentially have a long-term disability claim. So if we look at the ones that I've talked about here, so the ones that have fairly strong evidence, the ones that there's some evidence, and then the last 2 surveys that I talked about, the Start Back screening tool and the WHO's model disability survey, I've highlighted in red the items that the WCB collects on all of its claimants. So it does store data on all of the claimants, and so it would take the person's name, their birth date, which they can then calculate the age, and their address and things like that. But of the ones that we have here that we would be interested in possibly using in our as potential predictors, age and sex are the only 2 that they have, that they routinely collect on everybody. So if we were to ask them for data on previous claimants, that's what we would be able to get from them. The ones in pink are ones that they collect some kind of information on. So for instance, job involving heavy work, they do record what occupation the person has. And you may be able to some degree infer whether they're potentially doing heavy work or not, although that's kind of dubious because even in different occupations, there's going to be different demands depending on a lot of different factors. So, trying to rely on that as an indication of whether they're doing heavy work is a bit problematic. History is similar to back pain. They can tell you whether the person has had a previous back-related injury claim, but that's as far as they can go. So you can get some information on that. But there would be a lot of back pain that would not be workplace related, and that would not be reported at all. So again, you can't kind of rely on that. And then they do also record whether the employer has had contact with the healthcare providers and with the WCB in terms of something like that, but they don't really record what that means and whether there was any accommodation or early return to work. That may have happened, but it's not reported. So in terms of, if we wanted to proceed with this, as I'll talk about in a couple of slides here, we're kind of limited if we were to solely rely on what the WCB routinely collects. So the data that they routinely collect, it's quite limited in terms of the kind of objectives that we had for this project. So that kind of leads into the project design and methods. And so this goes back to what I talked about initially. So the objective of this project is to look at whether we can use risk factors that can be sort of collected from claimants at their claim initiation, and then predict whether they eventually have a long duration claim and long-term work disability. Now, there's two ways that you can essentially sort of approach this kind of a project. One is with what's called a retrospective design. And so a retrospective design is where you start kind of at one time point, and then you look at data that was collected on people in the past. And so you start with people after you know how long their claims are and whether they were on long-term or whether they are on long-term disability. So you start kind of on the right side of that arrow, and then you go back and you look at data that was collected on them when they initiated their claim. So you're going kind of backwards in time, if you will. And so the advantages to that are the ones highlighted in green. Typically, this will take less time because all the data that you're going to be able to use has already been collected. It's stored in whatever database, and so provided you can get approval from ethics and from the WCB to actually use that data, then it's a matter of just extracting the data from their database and then giving it to the researchers, and then they run their sort of analysis with that. Because it takes less time and for other factors, there'd be a lower cost associated with it. And the other major advantage is that you could potentially look at all the claims over a certain time period. You wouldn't be restricted in that. So you would look at all the claims over a 2 or 3 year period, or however long you wanted to look at. The major disadvantage to this is that you're restricted to the data that's in that database. And as I showed you a couple slides ago, out of all the predictors that we wanted to use, only 2 of them are routinely collected and stored by the WCB. So that's a major limitation. We would essentially be restricted to only looking at age and sex as a potential predictors, and that's obviously quite limiting. So the other way to do a study like this is to go forward in time. So you are starting at claim initiation. So when somebody submits their claim, that's when you collect whatever information you want from them. So WCB is going to collect certain information, but as the researcher, you can go in there and collect the other information that they don't routinely collect. So you can collect all the information that you potentially want, and then follow those people, or at least track them somehow with the WCB system, and then at some future time point, then find out how long was their claim and whether they were on long-term work disability. And then, so essentially you're working forward in time with this type of a design. Now, the major advantage and disadvantages here are sort of the opposite of the retrospective design. The one major advantage is that you have control over what kind of data you are going to collect. So all the different factors that you're interested in, you can actually ask the people that and get that information. You're not being restricted by the limitations of what the WCB routinely collects. However, the disadvantages are it takes more time. So as I mentioned with the retrospective design, all the data that you could potentially use has already been stored somewhere, and so it's just a matter of pulling it out. Here, because people, once they initiate their claim, they could be on this disability for 6 months, a year. You have to wait a certain amount of time to get that kind of information from them.
to find out how long are their claims and whether they're on disability, long-term disability. There's a higher cost associated with it, and as well, when you're doing it like this, you can only generally get information on some of the claims, because you can't force all the claimants to answer your questionnaire or to give you this information. The WCB can mandate that people give them certain information, like their name and their address and that kind of thing. But as a researcher, for ethical reasons, we can't force people to complete our questionnaire. So you're only going to be able to collect information on some of the claims, which again is one limitation. Ideally, we would get information on every claim over a certain time period, but we're restricted to those people that are willing to complete our survey. So we are currently in this phase of our project, so the first 12 months. We started data collection formally. We kind of piloted it from January to April of last year, and then we officially started last April. So far there's been 340 people who have completed our survey. Our target was 400 for that first year, so we're actually on pace to be able to get our 400. The WCB has already kind of said that if we need another month to hit that target, that they're willing to extend it into May. The way that we are collecting data is that every claim, so when a person's healthcare provider files a claim for the person for a back injury related claim, people who have an email address that they've provided, they receive an email directly from the WCB, not from us, not from the researchers, but from WCB. And that includes a link to a survey using Qualtrics, it's a survey software. So that has a link to that survey. And so in that survey then, they get asked a series of questions that's in 5 parts. You can see that the part A, there's sort of individual questions for sort of prognostic factors that are individual. So things like age, their sex, what kind of provider did they see initially, and like a medical doctor, chiropractor, physiotherapist, whether they've had similar previous back pain in the past, radiating leg pain, recovery expectations, things like that. And then we have a pain rating scale to measure their back pain sort of intensity at the initiation of their claim, a disability, a back pain specific disability questionnaire, and then the Start Back Screen tool and the WHO's disability survey that I mentioned. So to complete all of that takes on average around 15 minutes. So that's kind of the average. I actually was thinking it was going to take longer than that, but during the initial pilot phase, when people were completing it, the average people were taking was about 15 minutes. I think there was the odd person who was going upwards of 20, but I don't think anybody ever went above 20 minutes. So it takes about 15 minutes to complete the survey. And everybody who does complete the survey gets a $30 honorarium. So as I've taught the research method students, the hardest part of any research study involving human participants is getting people to take part in your survey. And one way to, well, I guess it's 2 things. One is to compensate them for their time, because it does take them time to do this, but also as a way of saying thank you for participating in our study. A small monetary compensation is usually a way to help entice people. So everybody who does complete it can then, there's a secondary survey, where there's a link at the end of the first survey which takes them to a second survey where they can provide their name and email address, and then they get an e-transfer for $30. So that's a way, again, to try to improve the response rate. And so we're currently, as I mentioned, we're about 10 months in. We've had about 340 people. We're targeting 400. So probably in May, we'll be stopping the initial phase of it. So essentially, we'll be done that first bullet point. We'll be have collected all of the information we want from claimants at their claim initiation. And then we have to wait, because people who are submitting claims now, their claim duration, or say next month or the month after, their claims may extend another 6 months or a year or whatever. So we need to wait at least a year following when we stop the initial phase of our data collection. So then there'll essentially be a pause on this study while those claimants that are submitting claims around now, while they're working through the system, and then next spring then we'll get the data on the second part of it. So then we'll know how long all these claims were, and whether then categorize them, whether they were on long-term disability or not. And then we can run statistical analyses with 2 different outcomes. One is claim duration. So looking at the number of months they were on with their claim lasted, and then again whether they were on long-term disability, using either a 6 or a 12-month duration as the way to categorize people who were on long-term disability. And again, then entering all of those different predictors into the analyses and see which ones are the best predictors. Because it takes about 15 minutes, as I mentioned, for the survey now. We would like to get that down to obviously about a 2 or 3 minute questionnaire, something that's a lot shorter. That the WCB then, the kind of goal of that, the future directions here, is essentially to have an objective protocol. So we have a 15-minute survey, which is a bit long. Some people wouldn't be willing to complete that at the beginning of their claim. So ideally having one that's about 2 or 3 minutes long, and then so that the WCB could then have that as part of their internal process. That when a person's claim is submitted, this is something that the claimants, because for practical reasons, we as researchers can't force people to do anything. But the WCB could make it part of their protocol. That when you submit a claim, before it's adjudicated, you have to complete this 2 or 3 minute survey. They could have that as part of their internal process, and that's what they'd like to do, is have some kind of a short objective protocol that they ask maybe 5 or 6 questions, depending on what the predictors show. And then based on that, then their system can be set up to essentially screen all those intake questionnaires that their claimants submit, and can essentially then flag or highlight cases that, based on the protocol, are predicted to be long-term cases. And then the kind of challenge comes, okay, well, we can accurately, to some extent, predict who's likely to have a long-term claim. What do we do about it? And that's kind of the next major step that is probably 2 or 3 years down the road, is maybe looking at some kind of different kind of targeted therapy, like cognitive behavioral therapy, or doing something different with those types of claimants in terms of trying to reduce the time. And then another study would be then seeing if that actually works. So seeing what kinds of additional treatments or additional procedures that we can do with those people that are predicted to have long-term disability. Does that actually work? Can we reduce their claim duration, their claim cost? And then also, not to be overlooked, is the benefits to the claimants. So if we can shorten the duration of their claims, they can get back to work. They can have less disability in terms of managing their work in their home life. So as a father of 2 young kids, I understand what it means to, if I had to have back pain that was limiting my ability to walk and to move around, my ability to interact with my kids would be limited, which obviously would affect my mood and everything else like that. So being able to have people be able to enjoy their lives and to be more productive would be a benefit as well. But again, those last 2 points there, that's kind of future work. The objective of this study is to essentially do those first 2, where we can have an objective protocol that hopefully is relatively short, that the WCB can start implementing, and then identifying claims, and then kind of we could maybe try to figure out what to actually do with those people that are predicted to have long-term disability. And lastly, I just wanted to acknowledge the WCB and the Chiropractors Association of Saskatchewan. So they are co-funders on the grant that's supporting this project. So obviously without their support, we wouldn't be able to do it. And one final acknowledgement, I used to do this at the end of all of my research presentations. Whenever I went away to a conference or did any kind of research presentation, I would always end by doing a certain acknowledgement, and I kind of realized I got away from that a bit. Looking back at some of my recent presentations, I kind of had stopped doing that. And I guess over COVID, like with a lot of people, it made me realize to kind of focus on the things that are important in your life. And so for me, that's my family. So I want to acknowledge my incredibly supportive wife and our 2 beautiful boys. So they are my oasis in this crazy world. So I just want to acknowledge their support as well. And I will now, I guess there has to be some questions. I will now happily answer any questions.
All right, thank you, Dr. Bruno, for your presentation. Yes, we do have time for questions, so if anyone has questions, I'm going to come over with a microphone so that we can hear those. Does anyone have any questions?
I'll ask a question. I don't need the mic.
Oh, no, it's gonna be on.
Thanks for the presentation. I have a quick question about one of the factors with regards to the workload, how heavy the workload might be. Are you going to look at all at job safety analysis of certain roles that would actually flag for you the frequency of certain moves and, you know, what kind of weight they move in the run of the day, that kind of thing? I work in the healthcare sector, so that's my motivation for the question. But I think there might be some potential to look at, you know, on the prevention side of things, not once somebody has an injury, but if sometimes people will have an injury and not necessarily report it right away. They wait until there's a severity point and then they will report. So if there's a way to get that information to the front line sooner in terms of what to pay attention to in their actual role, I'm just curious.
Yeah, we haven't included that as a question in our questionnaire. I mean, there could be questions related to, you know, what kind of workplace safety procedures are in place and that kind of thing. I mean, I suppose that could be used in terms of identifying specific industries or specific maybe companies or certain things. Like if you had the ones that don't, they tend to have longer duration. I mean, in terms of, yeah, that would be kind of more of an like an industry kind of thing. I think looking at things like that. That could be something that we could look at adding in the future in terms of potentially looking at future projects and looking at, yeah, because I don't think WCB collects information on that. But that, I mean, in terms of, I would think that would be something they would be interested in looking at. So identifying specific industries or, you know, certain companies or something where they do or they don't, and they tend to have more claims or claims that are having longer duration. Yeah. But no, we haven't specifically looked at that in this study, so that's not part of the survey that we're doing now.
So one of your predictor variables was about sex and male sex. So I'm assuming that some of that, and it could be an assumption, is related to occupation and what you do in your occupation. Is there more to that? Is there something biological or that the literature talks about in terms of men versus women and why they might have more susceptible to this type of injury?
The studies that I've looked at that have identified that as a potential predictor, and again, there's some evidence, it's not as strong a predictor as some of the other ones. They don't really dig any deeper than that. They just say, you know, when we run the stats, males, the odd ratio is higher. So males are predicted to be. Why that is, they don't really go into whether, you know, anatomical reasons or physiological reasons or anything else like that, or occupational reasons.
All right, thanks very much, Paul. Just a quick question with respect to occupation, again, a bit of a follow-up. Do you think there might be any value in terms of drilling down into, so you talked about the broad-based occupation they'd be in, and then you said it might be difficult to determine what they really did with that. Is there value to drilling down a little bit more to provide that information to WCB that say, okay, within, you know, mechanics, heavy-duty mechanics present greater risk of injury or whatnot than light-duty mechanics or automobile mechanics, or similar in healthcare, a personal care aid versus maybe a physio?
Yeah, we do have questions in there related to heavy work. So we are asking that, and I suppose we could then ask WCB for their occupation. We're not actually asking them for their occupation, but that is one of the things that is recorded. So I suppose we could look at that and try to dig a bit deeper on that in terms of looking at people with different occupations and those that were doing heavy work versus not doing heavy work. There's the potential of doing something like that. Yeah.
Other questions?
Thanks, Paul. One question that came to mind, you had mentioned as one of the factors relates to like access to early return to work programs. What dictates that? Is that dependent on profession or geography or? Yeah.
I would think it's probably like multiple different factors. I would think, yeah, like geography might be a part of it in terms of, you know, certain employers might be more willing to do something like that, offer them accommodations versus not. Certain types of work, it just may not be possible, but I would think you could always try to find something for for people to do. Like you can modify their job or have them do something slightly different for a while they're kind of recovering. But you know, in terms of like when I was practicing, and I didn't see that many WCD sort of cases, but I mean the cases that I kind of saw, trying to work with the employer, saying these are their restrictions, these are the things that they need to avoid for the next 2 months or whatever. Is there something so that kind of communication, whether that always goes on between the healthcare providers and the employers, so if the healthcare providers aren't going to communicate with the employers, that might be a barrier as well. But yeah, there's probably a variety of different barriers that might account for that.
Thanks. Yeah, I just have one other question. That's just more kind of nitty-gritty. I'm just curious with the questionnaires. Will you break it down by items, or will it be like a sort of global score on the questionnaires going into your regressions?
Well, for like the Roland Morris Disability Questionnaire, that one hasn't been validated to look at individual item scores. The only way that's been validated in the literature for use is with, and in terms of how to interpret the values, is by a composite score, looking at the 24 items collectively. So for questionnaires like that have been validated as a whole, we would use that. But for the individual ones, then it would be individual items that would be entered in. So, I mean, for the WHO's disability survey, that's quite new, relatively new. And there's not a lot of evidence, and they do have different categories, like they have just there's the environmental, and maybe 9 questions related to that. I think that one, because there's limited evidence on how best to use that one currently, you probably could look at individual sections within that, the environmental, and then doing this, you could probably break it down a little bit more.
Thanks.
Any further questions? If not, please join me in thanking Dr. Bruno for his presentation this afternoon. All right, that concludes our presentation for this afternoon, so thank you everybody for coming, and maybe we'll see some of you in a month from now, or last one.